afternoon and welcome. I think we've opened up the communication to larger groups, so we're excited to go ahead and get started. Thank you everyone who's joining us on your lunch hour today. I know there's always a lot going on, and we appreciate you spending some time with us. Hi there. My name is Robin Brown. I'm with Cardinal Health. We'll get into introductions in just a second, but I'm excited to kick off today's webinar. The topic is strategies for staff recruitment, retention, and increased practice efficiency. So with that, I'm going to go to the next slide, and we're going to kick off with some introductions. Jay, why don't we start with you? We'll start with you and Jennifer.
Sure. Good morning, good afternoon, depending where you're at in the country. To everyone, thanks for joining us. I was honored to be asked by Cardinal Health to join them for this webinar, topics that I care very, very much about. But I am Jay Saliot. I'm with Advanced Rheumatology in Okemos, Michigan. I'm managing director here, but many of you on the call probably know me from the years that I was fairly active with Norm, still around, but not as much in a leadership role. So, and I'll kick it off to Jennifer, one of my former fellow board members.
Yes, thank you. Good afternoon or good morning, as Jay said to everybody. Yes, likewise, I was also asked by Cardinal and to join in this panel. This is a topic that is extremely critical, as everybody knows the medical terminology and the coding and everything else for running a medical practice. But the staffing, the personnel you can't do anything without them. So this is a great topic. I hope you all enjoy. I'm at MK Arthritis and Osteoporosis Clinic, the office administrator, and I've been there for about 10 years now.
Great, and then I'll turn it over to my colleague, Heather.
Hi, my name's Heather Walton. I'm a practice specialist on the Cardinal Health team, and I support practices like Jennifer's and Jay's with revenue cycle consultative services and solutions. Prior to joining Cardinal, I actually spent over 20 years leading medical practice, business office, and revenue cycle operations in both private practice and for hospital system medical groups across a wide variety of specialties. So I'm excited to be here today.
Yeah, and I'm Robin Brown. I'm a director at Cardinal Health within our kind of specialty pharmacy solutions area. And I spend a lot of time in medical practices and working with practice administrators and physicians to make sure their practices are running well and seeing how we as Cardinal Health as a distributor can help out. So really excited to be here today. I'll be the fearless moderator. So I'll keep the conversation going. And of course, I think there's a feature to ask questions or comments and things as the webinar goes on. So please don't hesitate. We want this to be really conversational. I think you'll learn we are all finding things that work and strategies that work, but there's no silver bullet. This is really meant to be a discussion and we'd love your participation. So that said, I'll move to the next slide and kind of kick us off. So as I mentioned, submit your questions anytime in the Q&A section. We'll answer them all at the end. So if there's duplicates or anything like that, we'll have a chance to go through those and see. The webinar will be recorded and it can be shared afterwards. So if you have folks that can't join or if you need to step away, we understand what it's like to be in a practice. I think Heather mentioned she's been in practice. I've worked in the provider side as well. So I know how your days can go. And then we'd ask that you please complete the brief survey at the end of the webinar. Helps us with content and planning and making sure that we have information that's valuable to all of you folks. So again, welcome. Thanks for being here. Whether it's lunch or earlier for you, we appreciate your time. And as I kind of mentioned at the title of our webinar, today we're going to talk a lot about strategies for recruiting and hiring top talent. We hear this time and time again in surveys and in different meetings that this is something that's important to practices and can be a little challenging, especially in these post-COVID years. We want to talk about creative ways for engaging and retaining current employees. We want to talk about thinking differently about combating staffing shortages by increasing operational efficiency. So when can you use tools and technology to do things maybe you've currently or previously had people doing. And then we'll wrap up. And like I said, we'll have some time for Q&A. And with that, we did a little bit of an introduction. We talked about ourselves individually, but I'll introduce kind of the organizations we're from. So As I mentioned, you can tell by my background, I'm with Cardinal Health. Cardinal Health is historically known as one of the big distributors in the medical and pharmaceutical space. But we also provide practice management support tailored to the needs of rheumatology practices. So it's not just about, drugs and GPOs. We've got tools, we've got experts. We really want to be kind of the first place you go if you have questions about how to run your practice. And we have the kind of unique benefit of working with lots of practices across the country. So getting to learn from examples that we see and have kind of a unique perspective. So we'd love to share that with you. And I'll turn it over to our colleagues from Norm to introduce Norm a little bit next.
Yeah, thanks, Robin. I think many of you on the call maybe are familiar with us, but the National Organization of Rheumatology Management started almost, I think it's been 15 years or close to it, or actually getting closer to 20, through CSRO, and then we were eventually spun off. We used to be called the National Organization of Rheumatology Managers, and that was changed a few years ago because we kind of widened our scope a little bit. So what, in terms of who can be a member, but the cool thing is we still care very passionately about effective, running of medical practices, specifically in rheumatology. So, basically we are the organization for anyone that cares deeply about running a great practice, an efficient practice, and also advocating on behalf of your practices with payers and with the government, et cetera. So that's Norm.
Fantastic. Thanks, Jay. And then we're going to kick off and kind of jump right in. So we're going to kick off with some discussion. We're going to talk about strategies that practices can implement or what you're doing today to attract and hire top talent. So I want to hear, examples that you've heard or things that you've implemented yourself. So we'll kind of kick off that conversation with this first bullet point.
Well, Jennifer,
Okay.
I know you just hired someone, so
Yes.
I think it's great for you to start us off.
All right.
Perfect.
All right. Thank you. Yes. So, like I said before, the hiring is extremely important. You want to have your office running smoothly. Patients notice when you have a lot of turnover and they'll comment on it. What we've done, 2 years ago, I went through kind of a culture training and came out. It's did amazing things for me. So I have not had any turnover in over a year. And it's been absolutely wonderful. The team is very cohesive. And we all work together very well. Some of the things, I guess the most critical thing that I have found when you're looking for your ad, you're putting an ad out, you want to talk more about not as much the roles and responsibilities. Yes, obviously that will be in there, but you want to talk about the culture and the type of person that you want. You know that you want somebody that's compassionate. If you want somebody that's let's see, we have mindfulness as one of our big virtues. So that's something that you want to put in your ad. And when you're interviewing, make sure you talk about it. That's actually been a very strong benefit to that we add to our list of benefits, is that we hold to our values, our core values, and the interviewees actually really appreciate that. That's a couple people have said that that's why they wanted to come, because we have core values and we uphold them. So there's then I guess the other thing that I do is let them know when we're interviewing, be more detailed about the benefits that you offer. It's not just the healthcare and the 401k and the PTO time, but if you have a dress down day, something like that, PTO sharing, we give their work anniversary day off. You want to highlight those unconventional types of benefits. We are very much a family run practice, and we always say family first. And that's how it is. We will do anything for for people to be able to work and have their work-life balance and keep their families healthy, healthy and going. So I could go on, but Jay, I'll let you jump in here.
Yeah, sure. So I 100% agree with you on the culture piece. Well, I agree with everything you said, but especially on the culture piece. I think that that is very important for a number of reasons, for creating a great place to work, doing your best to reduce burnout. I think all of those pieces feed into that. And we've kind of been, you know, when we're talking about attracting top talent, we've been in the lucky position that very honestly, over the past 10 years, outside of posting a physician assistant job with our state society for physician assistants, every other person I have hired in this practice was a referral from an employee, or sometimes even a patient who's like, hey, I know someone who's awesome. And I've been very grateful for that, because I haven't really had to spend the money to post a job other places very often. And then sometimes when you do, those of you out there know, you get like truck drivers who are applying for nursing positions, and I'm like, what about like need to be a registered nurse? Like, is not clear, right? So and what I like about the referral too is not only is that employer, that person kind of vouching for the person that they're recommending to you. We can also ask them the question, you know, the culture here, you know how we operate, are they going to be a good fit, right? So that way the person walking through the door already has kind of gone over a few hurdles, right? They've passed a few tests, so that I feel like we've got a better shot at it being a good fit for everyone, right? So I do think attracting talent. I mean, I haven't really had to put an official referral program, but I know there are companies that have really great employee referral programs that I think can be very beneficial. You can tie it to money. You can tie it to, you know, maybe some reward for the referring employee and the new employee you hired. And then if they make it like 12 months, maybe an additional, I mean, there's some really cool things that can be done, but I've really been a big believer in kind of using our own networks to find good people, and really kind of stacking the deck a little bit, right? When we've got interviews coming up. So yeah.
Well, that's great. I think, you know, as you say, with the referral system, there's also, we also like to just look at, for customer service, let's say, if we're looking for somebody at the front desk. We actually hired somebody who worked at the Wendy's drive-through window because one of the doctors in our practice had frequented there to get Diet Coke every day or whatever it was. And whenever this person was there, he was very impressed with her customer service skills and just initiated some conversation. And she's been with us for almost 2 years now. She's been great. So, you know, you can, a lot of times the attitude and what have you, you can't teach, but you can teach the physical things. You can teach them how to work on an EHR and things like that. So that's something else, another way that you can look for people and hire people. The other thing would be, sorry, Jay, did you have something to say there?
I was just going to say that was a really good point. I used to go to the Target before they were bought out by CVS. I used to go to the Target pharmacy, and there was a pharmacy tech there and I'm standing in that long line listening to how she dealt with patients. So I totally stole her away from the pharmacy, and I had to apologize profusely to my pharmacist for stealing her away. But she just was really great at dealing with people. And like you said, I'm like, I can teach you the rest of it. But you understand deeply how to connect with people, and that's so important.
Absolutely. Absolutely. So I was just going to go on to say that when you're interviewing the people that you do choose to interview, the questions that you choose are going to be very important. Yes, you want to ask your typical questions about their experience and what have you, but you also want to ask questions that are more behavioral based, depending on the role that you're hiring for. So for example, I just hired an office manager who we are very, very happy with. It's been almost a month, and I have no qualms at this point. But we ask questions like, well, if you had a patient that would come in and giving your team a very difficult time because they don't want to pay the no-show fee, and they've not shown up for about 5 visits, and how would you handle that? And they explained that they would take them in the back into another room, talk to them, and let them know that not showing up to a visit actually hurts 3 people. It hurts yourself, it hurts another patient who is in pain and trying to get in, and it hurts the practice. And we need to uphold, our commitment to that. And they understand. And I just think that that's a great thing. You also want to ask, how do you solve, when you have two employees that aren't working well together, or how do you encourage somebody to step up and do a little bit more, whatever. It's important to see how that they would react and how they would handle that with the staff. So yeah, it's, and then also how would they handle it if somebody feels that they're kind of left out, or they're not really, they're not part of things, and how to get them involved. And that's important to be able to find out.
That's great. It's a great example.
I actually have a great example if we've got a little bit of time. Okay,
Yeah.
cool. So Jennifer, totally agree. That whole concept of behavioral based interviewing, or sometimes called STAR, the STAR method. So it's you describe a situation, you explain the task, that's the T, of the responsibility, then you have the interviewee describe their actions, and what the result was. So really, really great. It really digs deep, because everyone has a canned answer to what are your strengths and what are your weaknesses, right? So a quick story, and those of you that I spoke at the Florida meeting last month. So if anyone here is from Florida, I apologize. But so we did this one time with when I was in a different position for the receptionist at the front desk, and we had this candidate that we thought was perfect. Like everyone was like super on board. Like, wow, she seems great. So then we asked her the question, well, tell us what your current coworkers might say about you and why, right? So just like, again, a little bit deeper question. And she thought about it and she said, they would probably call me the office supply Nazi. And we said, okay, tell us more about that. And she said, well, I'm responsible for office supplies, and they are constantly wasting pencils and paper clips. And then she went off on this tirade about how they're just like so wasteful and they don't deserve it. And so she's like, so I won't give them. And by the time we were done, we were like, oh my gosh, like this is not the kind of person we want for that would fit into our culture. Like, you're really not going to give someone a pencil because you think they're not being responsible with it. Come on, that feels a little like, no offense when I'm Catholic, but it feels a little bit like old Catholic school. So anyway, I really think that's a great thing. And again, you can really start to understand someone a little bit deeper beyond those like canned responses that they have to those interview questions.
Right.
So make note, there's free flying pencils at your practice,
Right,
Jay,
I should
right? That's
listen
one
as
of the
my
many
my
perks.
benefits.
All you care to write, I suppose. One other topic I wanted to ask about is pay. So, there's studies that show pay is not the final determinant of happiness, but it is a piece of a kind of total compensation, and really why a lot of us go to work every day, even if we love our jobs. How do you kind of evaluate pay effectiveness or pay competitiveness, I guess I should say? Does anyone have an example, or can you speak to what your practice does today?
We use the numbers on Indeed.com. We look there as a starting point. That's not always extremely accurate, but we start there, and then if there's anything that we can find on general for central Pennsylvania, where we are and things like that. There's always going to be different, like the larger provider practices that are owned by facilities can pay a lot more, smaller practices can't, but that's when you bring out all these other types of benefits that you have, because you're not going to have the luxury of being able to take care of your family in some of these hospital systems because you're 9 to 5 or whatever you are. So they're not quite as lenient, but and then your hours are steady. There's no holidays or weekends, so if you just stress some of those things, a lot of people really appreciate that. So it's really a combination. Yeah.
Yeah, that makes a lot of sense. So with that, I want to just kind of circle back on what we just discussed. Kind of in summary, there's some tips for hiring a top-notch team and what we've heard from the group. So seek candidates who complement your practice's culture, and this is often done through a referral system. Ask behavioral-based questions in the interview. We had some funny examples there. Role play to understand how candidates would handle various scenarios. That's another great one to really understand, not just what people say, but what they would really do. Evaluate your pay, use some benchmarking data as part of your kind of total compensation and culture. And then of course, prioritize a healthy work-life balance. We heard from a lot of our practices that's, something especially that they value today. And so wherever you can kind of highlight that. So thank you so much for those examples. Next, we're going to talk a little bit about what are creative ways your practice engages and retains current employees. So it's not just about new folks, it's making sure to keep your existing employees engaged. Could someone share some examples of how you keep practice employees engaged?
I can jump in here too. So we've created a mission statement for the practice, and we also use that in the interview, but we have that posted in our break room. And we also give everybody a little, like a 3x5 frame with the mission statement in it. So they have that at their desk. When they are hired and at their one-on-ones, we kind of review what their favorites are, their favorite coffee or their favorite candy or things like that. So that way you can always just put something on their desk, in the morning or whenever, if they did something that was nice, and that's always very appreciative. I know on the employee appreciation day, I went around and I got everybody something unique for each of their what they liked, and it was amazing the reaction that we got. So that type of thing goes a long way. Walk around every morning to say good morning and ask them what they need, if they need anything from me that day. And that's also very, very good. And then the other thing that I do is send out weekly updates. I think there are a number of practices that do that, have things on there like who's going to be out that week and the following week, so they know what to look for in terms of where there might be shorter staff challenges. When our lunch is being brought in by the pharmaceutical rep, so they know when not to bring in their own lunch. Whose work anniversary is it? And how many years have they been there? Just things like that. And I, one of our core values is communication, and I'm very big on that. So there's a section of notes, anything that's been updated, modified, in terms of workflow or policies, I listed in there. And actually at the very top, we put kudos. So we'll put any reviews that we get on Google or what have you, and call out the person or people that they're commending. But then also call out people within the staff that do something along the lines of our core values. And that goes a very long way as well. And then finally, I just want to say, in terms of recognizing people, I think you need to find out how each person likes to be recognized. Not everyone likes to be recognized in public. And that's another thing we do on our favorites list. How do you like to be recognized? So
that's a really good point. That's a really good point. Like, not everyone likes being like called up in front of the group or whatever. That's a really good point. I like that. Yeah. Well, a few things that I know, again, Jennifer and I think very deeply about this. I think as practice managers and everyone on this call can identify with this, you always have the best intention of paying attention to these kind of things. And then you lose a staff member, right? Or the EMR is kind of going crazy, or something else happens and you're pulled in 15 different directions, and sometimes it can really fall to the bottom of your list. So finding ways to be intentional about coming back to this over and over again, really creating that work environment that engages employees. And one resource I've really been able to use on that is Gallup. They have a wonderful, you can like go Google Gallup employee engagement. There's a whole lot of information out there, a lot of it for free that you could read, where they talk about how engaged employees, how you build a work environment to engage employees, and that leads to employee happiness. Like you suggested, Robin, beyond pay, right? Pay is important. We all need to get paid. It's why we work. But there are other important things about that. And oftentimes people will work for you for less money because you are offering that great engaging environment. Specifically, they have a concept called Q12. So it's the 12 questions that they know over decades across all different, healthcare, retail, technology, across all those different environments, that those are the 12 questions that matter most to employees and how engaged they are going to be in their environment. So that would be another thing to look up, the Gallup Q12. And it's things like, do I have the tools that I need to do my job correctly? Do I know what's expected of me at work, right? And they really kind of go through all those things, because if you think about it, if you're going into work every day and you thought your job was to schedule patients, and then you're getting hauled into a manager's office, getting yelled at because, the garbage didn't get empty last night, and you didn't think that was your job, or your job to make sure that it happened, well, you're going to hate going to work every day, because it's like, well, what next, right? What else am I going to get blamed for that I didn't even know was my responsibility, right? So using those questions and then connecting with your employees on a regular basis to see where you're at and then to make improvements, I think is really powerful, and really has helped our practice get to a very, very low turnover rate. So, I mean, people leave us, things happen, people move, people get awesome job offers that I can't compete with. But for the most part, we have very, very low turnover here, and we at our practice attribute it to that effort.
That's fantastic, Jay and Jennifer. I mean, Jennifer, it sounds like you really pride yourself and kind of push this culture of getting to know your team and making sure that people feel valued in ways that are meaningful to them. And then Jay, I love that you bring in kind of outside resources. I mean, there's experts that study this stuff, so why not go after and find those kind of strategies that work? So that's really great to hear about how you're retaining your current employees. Well, one thing I'd like to kind of talk about next is a little bit of a deviation. So we've spent the first part of the call talking about how to really focus on people, bringing people in, keeping folks happy. But I'd like to talk a little bit about utilizing technology to increase operational efficiency. There's a lot of discussion about AI and tools and things like that. And of course, I think in a lot of ways, especially in healthcare, it's important to not rely on technology for everything. People like a human face at their doctor's office. And of course, the field of medicine is very human based, but where can we bring in some help to make our loads a little lighter, or to maybe not spend as much time so we can really focus on the pieces that are important? Let's talk a little bit about some tools that may be available, excuse me, to your practice. I'm getting a little tongue-tied.
Yeah, so I'll jump in. I mean, at the very beginning level of the practice process, things like, if you're short at the front desk, maybe you want to implement something like a patient kiosk for check-in, things like that. So, supplementing that front desk staff, obviously, that personal face is very, very important, but maybe there's pieces and parts of that patient check-in process that you can automate. Then when you get kind of more to the back office processes, things like connecting your charges and your billing system together. In the olden days, we used to manually enter all of those charges, but if you can implement, maybe an interface between your EMR and your billing system to bring your charges into your system, and implement scrubs and edits and claim edits to kind of do that pre-check of your claims, at the very front end from that. I think those things can really help. And, I've learned that just when you think you've got like all your problems solved with everything, something comes along and messes it up. As we all know, this environment constantly changes. We've got new codes, new payer rules, new policies, new medications. You really have a lot to stay on top of. So that really means that things are never going to be perfect. But I am a believer in the power of technology and data analytics and the importance of them in understanding, the key aspects of the practice operations to know, where am I performing well and where might there be opportunities to improve. So like when something seems off, you can always ask your team for their opinions. And, I would say back in the olden days, that's what we did because we didn't have a lot of data analytics. So you'd talk to your billing staff or your front desk staff or whoever to say, hey, what's wrong? Why is our cash flow declining? We don't know. And, those answers are good and it's really important to engage the staff. But I would actually caution people too, to know that it may be the problem of the day. So that answer may be a little subjective. So you may not actually be able to get down to the bottom of the problem. In addition, you can try pulling reports out of your EMR and your practice management system. You can combine that data together and throw them into spreadsheets. I will tell you, I did that for years. But it is very time consuming to get that information and to put all that stuff together. So I do believe that taking advantage of a data analytics platform that does a lot of that work for you, it can really save you significant time, help you quickly identify the issues and drill down like into those root causes so that you can fix the problems where they start, or at the very least, point you in the right direction of the problem. So kind of thinking about a good data analytics platform and some questions that it can help you answer, it can help you figure out, which drugs that you have, what's profitable, what might be underwater, and based on the certain payers, that's a lot of moving parts and pieces. We got a lot of codes in our systems trying to figure that stuff out. So if you have a platform that can put all that together and give you those answers, at the click of a button, it's definitely time saving. How long is it taking you to get your claims out the door? Obviously, a very important metric to be able to measure, but hard to calculate if you're doing that manually. Who's denying your claims and what are the reasons for those? Same thing, a lot of data in your systems, trying to pull out that information and aggregate it takes a lot of time. If you have something that can do that for you, makes it a lot easier. How long is it taking to get paid? And do you have any problematic payers? Like, are your payers taking longer than their contract timelines in order to pay you? Are they paying you the interest that they're supposed to pay you? Are they actually paying you your correct contracted rates? Again, I'll say it again, very hard to get that information, but awesome if you have a system that can already help you do that.
That's fantastic.
One really quick point on that, Heather, you are totally right about, you were talking about subjectivity, I think, right? So emotionally, we might be really mad at a payer because it just so happens that like the last 2 infusion denials were that payer, but statistically, they may not actually be the worst. So having that hard data can be really helpful because again, we have that goldfish short memory and it's like whoever did us wrong last is kind of who's on our list. So that's a great point that you made.
Yeah, very true. It is very, very true.
Fantastic. And in just a second, we'll talk a little bit about a solution I'm gonna recommend. But before we get into that, let's move to our next slide. Do you want to speak a little bit about kind of getting some help with this stuff? It's complicated, so there's experts you can bring in. Heather, can you speak to that a little bit?
Yep, sure. So as we all know, like running a practice is a very busy job. And I always used to call myself a firefighter, right? Daily fires to put out, problems that need my immediate attention. So, kind of what happens in that world is it makes it hard to get your to-do list done. We all have these lists and these projects and these tasks that we want to get done, but they always get put on the side while you put out those fires. And sometimes these projects are more time consuming, but they're very important. Things like, I want to analyze my AR. I want to really look into my denials. I want to update my claim edits, implement a new technology, build a KPI dashboard. Like there's all these things out there that we all would love to implement, put together a training program for my front desk, streamline my prior authorization workflow. So thinking about all that, when I was in a practice, my office was a revolving door all day long. So for me, that meant that I needed to stay late, use my weekends, and that extra time to work on these special projects. So I would say that if it's the same for you, you might want to consider engaging just an outside consultant to help you with those specific little projects, someone who understands your specialty and your business. So in this case, it doesn't have to be like a big undertaking, but sometimes a consultant could come in and help you with a specific focus, a project, work efficiently with you and your team to kind of get those projects completed and checked off your list. Because sometimes those things they won't necessarily take a lot of time, but it's finding that specific time to address it. That's really the challenge.
I'd like to vouch for the work that your team does, Heather, with the consulting. One time that when we asked you to come in and help us out, and you did a review of our revenue cycle, basically. And you were able to point out places where, that we may not have noticed as being an issue. And you're able to help us focus on where we needed to be looking. And also pointed out places that, we were doing things well. So that way we didn't try to make changes there. So yes, you guys do a great job with that.
Oh, thanks, Jennifer. Always wanting to help.
Yeah, we appreciate that call out. And then the last kind of technology tool we'd kind of encourage you to take a look at is looking for ways to reduce manual tasks. So one thing I'd recommend is, potential inventory management solutions. So of course, Cardinal Health offers one. It's a very creative name, IMS, Inventory Management Solution, but it's a system that goes in and can help kind of automate your ordering and how you're dispensing drugs to patients. So it's one of those things that provides, great control and just takes one thing off your plate. Of course, it's like anything, it takes a minute to get set up, but we've got a wonderful team of customer success folks that come in. You get assigned a technology account manager. They can even come on site to your practice, help that get set up. And once you're used to using it, you'll wonder kind of how you did it in the past and how you're doing it manually. Because again, it's one of those tasks that takes time and can really free up some time when you automate it. So
yeah, I can just add real quick.
Yeah, go ahead.
I appreciate that. Uses it, and it goes not only just for the clinical team for the inventory control, but also the billing, to make sure that we're billing for all the drugs that we use, make sure that we're billing appropriately for specialty, or not billing for specialty, and billing for buy and bill and things like that. So it's very helpful tool.
Yeah, and I have to call out something that you said, Jennifer, when we were preparing for this webinar. You mentioned it's not a tool that I use all the time, but my team does. And I love to hear that, because that's a sign of a good tool. It does its job and you don't have to get involved. That's exactly what we want it to be. We want it to be hands-off when it's working. So I don't want to put you on the spot for calling out something you're not doing, because that's exactly what we want to see. So I just wanted to kind of call out that example from our conversation.
Sure.
Yeah, for sure. So all of that is to say, of course, Cardinal Health has solutions to help with the sort of automation and tech pieces that we just talked about. We've got our GPO contract dashboard, our inventory management solution, so our IMS tool. Heather talked a lot about practice analytics. We have a proprietary tool. It's called Advanced Practice Analytics that comes in, aggregates a lot of the data feeds that are coming into your practice and puts it into a nice spreadsheet that, nice kind of dashboard that you can take a look at and make some decisions about how you operate your practice. We've also got payer contracting solutions. We've brought in a firm called Payer Health that we partner with. We've got some sort of preferred rates to come in and really evaluate your existing payer contracts and then go out on behalf of your practice and get you better contracted rates. We've got some experience, quite a bit of experience in rheumatology, so we'd love to help there. We've also got prior authorization solutions through our partner eBlue, so we can happily talk to you more about that. And then of course our revenue cycle consulting services that Heather touched on a little bit. And all of these services are available as part of your GPO contract. So reach out to your sales rep and they can talk more about it and set you up with myself or Heather or other members of the team that kind of help bring these solutions to life. So just wanted to kind of sum that up. We're getting close to time here, so I'm going to go a little light on the closing here because I think we've got a couple of questions at the end. We've got about 2 minutes left, but just sort of in summary, I mentioned this at the beginning, Cardinal Health is known as kind of your distribution partner, and we want to be and kind of are working really hard with our practices to be a little bit more than that, to offer GPO services, tech solutions, partnerships like the one with Norm, biosimilar expertise, personalized support. So if you've got a question about how your practice is running or certain drugs, please reach out to your sales reps because they're able to connect it with experts that go beyond just, making sure drugs arrive to your practice. So with that, well, we've got a couple of minutes left. If we could jump into those polling questions. I don't know that we'll have a time for a lot of questions, but again, if anything sparked your interest, please answer the polling questions and please reach out to your sales reps. We'd love to do a kind of one-on-one call to answer any questions with you. So here's our polling questions. Hopefully you have a chance to answer those. They're pretty easy and there's no wrong answers. Of course, there's a preferred answer, but there's no wrong answers. And with that said, I just wanted to thank our colleagues from Norm for taking time out of your day to be a part of this conversation. We really respect all the work that you do and love to continue to participate in these experiences. And thank you to Heather as well. We really look forward to hearing from you and helping out your practice as best we can. We want to see you succeed because that helps us succeed, obviously. So with that said, I think we'll let everybody roll off and say thank you. We'll let you get back to your busy days of firefighting, as everyone so fondly calls it.